We all know that healthcare is expensive and we're always looking for ways to save money. But what if you could help your employees by giving them better healthcare? Hi, I'm Hanh Brown, and in this video, I'm going to show you what employers can do to provide better healthcare for their employees. During the pandemic, employers helped with problems in their healthcare system and should continue to do so after the pandemic. Employers should play a more active role in shaping a better healthcare system. So in this video, let's look at priorities what employers should invest in to help fix these problems. The COVID-19 pandemic was a huge issue for employers. It not only had an impact on their human resources and business continuity plans, but also how they viewed employees' health in general due to the fear of infection or death from this disease. Employers learned new skills and gained new capabilities as they dealt with the effects of this disease on their people and their operations. Large employers can take what they've learned from these experiences to improve how they pay and manage healthcare for their employees, which could help change the entire U.S. healthcare system to provide better and more affordable care. After a few weeks, some employers made an emergency plan. They had to make decisions on important topics like closing their office or needing outside help for things like testing COVID. These decisions were on many different issues, including if they can work from home or if they can change their benefits. Local context and data were used to make decisions. Many companies realized that they needed to find ways of creating unique solutions for their businesses. They didn't want to rely on the healthcare system, so instead they started deciding who was safe to be at their organization's work sites and who was not. When it became clear that the public health system did not have sufficient resources for contact tracing, many employers took that into their own hands. They can't rely on the government or other organizations for healthcare. They need to look at their employees' unique needs and figure out what kind of healthcare they need. This is the core concept called population health. Employers should invest in these areas. They are important now and in the future. 1. High-quality telemedicine and digital health services. After the pandemic, employers need to contract with these services to make their employee benefits or work with their third-party administrators and brokers to ensure that the plans they fund support these services. They should also include virtual delivery of comprehensive primary care, psychiatry, other forms of mental health therapy, and digital health services for diabetes management. Employers can set high expectations for their workers to provide these services. They need to make sure they are high quality, easily accessible, and affordable. They might also need to work with their community or public agencies to ensure everyone has these services, even if they live in rural areas or are part of a minority group. 2. Home-based services. The number of people who need care at home increased during the crisis, reflecting the trend that people want to receive care outside of a clinic or a hospital. Many companies use texting to stay connected with their patients recovering from COVID at home. So originally, home-based care was made for older adults and Medicare patients, but now it is for working adults too. So over the last 20 years of research, hospital-at-home care has been proven to be safe and effective. Programs that help you monitor COVID from home is very good because they help you avoid the hospital when possible. Employers should pay for these programs because they are cheaper than going to the hospital. 3. Self-testing can be a way to test yourself. It's better to do this at home, and it's more helpful because people are scared of going out. You can also do self-tests for diabetes and high blood pressure. An employer can also cover these tests or contracts as part of the healthcare benefits. This will make it easier for people to stay healthy and get preventative care. 4. An integrated approach to mental health. COVID also showed us a big problem with mental health in our country, and many people are affected by it. For example, stress, depression, anxiety, substance abuse, and suicide. 70% of employees have these problems now, which was not true before the pandemic. Traditional approaches like employee assistance programs do not work well for this kind of problem because many people don't use them, or perhaps they don't work very well. We can find out if someone needs help by checking claims data and pharmacy data. We can identify people who need help, for example, we might see that someone has taken a lot of sleep medication but doesn't go to their primary doctor. 5. Social needs and health disparities. The devastating differences in mortality suffered by the underserved communities during the past 18 months are not unique to the pandemic. Decades of scientific research reveal that what matters most in determining a population's health is their income, education level, health behaviors, and environment. Society and government need to make systemic changes if they want people to be healthier. But employers can help too. Employers can provide education for their employees for career growth and offer benefits like childcare or transportation to help people who live in these areas where there may not be as many doctors. 6. Risk-based contracts. There are some risk-based contracts that give the employer a chance to share the financial risk of healthcare. This is an option for employers who want to reduce the risk of paying for their employees. They do this by sharing it with insurance providers or health plans and systems. These contracts require good quality and cost savings from the provider side and also the employer side. 7. Some companies are now making changes to improve their population health and value-based care. To succeed, they must take the lessons from their response to the pandemic and make a permanent structural change that show how responsible they are for their health and their employees and what it costs to care for them. Employers are in a good position to help fix the problems in the U.S. healthcare system that emerged during the pandemic by speaking up and investing their money where it is needed. What are your thoughts? Please let us know in the comments. If you're new to the channel, welcome. I'm excited to help people in the best part of life. I hope that you'll join this community on our journey through aging, caregiving, longevity, and attitude towards growing older. So please subscribe to the channel, press that like button, click on that bell icon to get notified when there's a new video.